Good morning. I'll tell you that it was something. That's the way I'd like to open. Those of you that are looking forward to doing it, I can't tell you what a good time you're going to have and how appreciative the folks are. I'd like to open with the cooperation between the hospitals. Located in the Greenville area, the Greenville hospitals really took the lead on this, but there were volunteers from everywhere, clinical and non-clinical, and it was amazing. And you saw other CEOs and chairmen of boards there that were able to come and spend a half day or a day or 2 days with us to help make this a tremendous event. Behind the scenes, you can't imagine everything that was done. For example, we had radiology there. It was one of the things that the medical leadership decided that we wanted there, but we had to get DHEC involved. We had to have the materials brought over, things built, processed, and then after we read them, then we had overreads by radiologists. So the cooperation among so many different people was truly amazing to me. We really did meet the patient's needs in a lot of levels. The first level being that they got what they came for, if you will, if they needed medication like that lady said for hypertension or diabetes. But we also took care of patients we didn't expect that were going to DAD, that dental access days, that had hypertension that they wouldn't have pulled their teeth if the medical folks didn't clear them. So we were able to help those folks too, which was a surprise we really didn't anticipate to do. 6 patients had to go to the emergency department. One of the docs picked up a retinal detachment. Hats off to him or her, I'm not sure who did it. But that was just the beginning of the day, because then these folks, after they got their prescriptions, went and talked to the pharmacy. They had to then go through what we term the educational gauntlet. So they weren't there just to get a prescription and go. They had to go and talk to folks, or at least be encouraged to, and we had mental health there, substance abuse services, actually STD services, nutrition, physical activity, and all kinds of other educational things, including heart, stroke, again, diabetes, hypertension, smoking cessation, and lots of different cancers that would be discussed. Then finally, they were allowed, if you will, or kind of shepherded to their county's table, where they were put into the healthcare system and hopefully got primary care access that they could afford, because as you saw, most of these folks were either uninsured or underinsured. So that was kind of the patients being taken care of. I think the volunteers, what we got out of it was incredible. We did have 4 medical students help us, and 4 residents, 2 of whom were first-year residents, interns, if you will. And I'm going to close with one of them, and understand this guy's been out of medical school in only 6 weeks. And he sent me a note, and I want to read it verbatim. I think that Mission 2010 was a great way to provide so many useful services to so many people, and I'm not just talking about the patients we saw. As residents, it allowed us to extend our knowledge base and learn new things about patient care, as well as use the knowledge we already possess to help those who needed it most, the newly medically uninsured. It was amazing for me to see that many of the patients share many features with myself and my family. I truly realized that they were once hardworking individuals who have just come under hard times due to the current economy. It was heartbreaking and eye-opening all in one. It was truly a humbling experience to help those who needed this at the most desperate times. I can't wait again until next year to participate. So I think that kind of summed it up for the providers.